Dr. Gardner, thank you so much for spending time with us. I'd love for you to give us an overview of what you'll be discussing in your Grand Rounds presentation entitled Integrative Medicine Group Visit Technology to Empower Diverse Patients with Chronic Pain.
Thank you, Shannon. I am going to have the thrill of talking about a online technology that really is trying to enhance a group medical visit called Our Whole Lives in eHealth Toolkit. And this has actually been a journey for me, a career journey for me. So I got to take people back in time before the cell phone when we were just, on the internet and dipping our toe into using technology to bring people together to deliver integrative medicine mindfulness via the internet. And when we actually first started our research, there was no mobile phone. So what we're doing now today in adapting this Our Whole Lives eHealth Toolkit to an app, to the phone, and the idea that you can bring your community where you go, and you can bring your integrative medicine tools where you go, your mindfulness on the go, nutrition on the go, movement on the go. So I'm just so excited to take people on that journey.
One of your areas of expertise is guiding people through group medical visits. What would you say are the practical advantages and also anything unique about that setting versus a one-on-one experience?
My curiosity about groups actually came from this recognition that many of our integrative modalities like Tai Chi, Qigong, yoga, even acupuncture, group-based acupuncture, the interventions or these traditional practices happened in groups, right? So then the question came to me was there something, is there something about being in a community with people, trying things new with with a group of people, that enhances our health, that changes our behavior? And so I think I've been studying this for the last 20 years and using mixed methods. So we have our focus groups and we have our surveys to try to capture what is going on in this group of people. How is it that being together, making a connection, knowing that you're not alone, seeing people try new things, seeing yourself reflected in your own culture and your own life experience, how does that help our help health? And I definitely think during the pandemic, when people were so socially isolated, the research around loneliness and isolation and how that does affect our health was really emerging. So this idea that actually for patients with chronic conditions like diabetes, chronic pain, heart disease, that when you bring people together and you give them the tools in with their neighbors, the almost the group visit participants almost become family, right? When you're trying to make these difficult behavior changes with your family, sometimes it can be easier. I love learning about groups and studying groups. It's been very rewarding. And the last point I'll make about it is that as we think about bringing these evidence-based interventions, like we have tons of clinical trials around the efficacy of Tai Chi and Qigong and yoga, acupuncture, nutrition, right? Teaching kitchens. It's pretty clear that these things work. But now the new question is implementation. How do you bring them into a very busy healthcare system that might be low on resources? How do you bring them into healthcare systems to make them billable by insurance so that patients who don't normally have the out-of-pocket expenses to pay for them can get access to them, right? Because evidence-based intervention should be accessible to all, regardless of your ability to pay. If there is evidence that something's working, you should have the ability to access that. So now we're thinking about this idea of a group medical visit where you're bringing the intervention in, like you're bringing the Tai Chi class in, at the same time you're getting medical care. And that the fusion of the two is what we call an integrated medical group visit. So you're using the group visit, the medical group visit, as a vehicle of delivery of the evidence-based intervention.